So a very good morning, friends. At the outset, I'd like to thank Srini for alerting me this particular program, biometry. And I would also like to invite the faculty members. I'd also request the co-chairperson, Dr. Sunil, to come up on stage. Rohan is already there, and Dr. Arvind. Arvind must be busy. He's part of the host committee. So biometry has always been a very important topic. Just the other day, when I had operated on a nurse from the Middle East, on day one, she was 6/6 partial. She was very happy. And when she came for glasses after a week, she had 6/6 blurred. And there was some amount of, some cylinder in her vision. So she was visibly disturbed, though we are pretty happy with the results. So it just shows that when we consider biometry, it is not only the newer devices or equipment that have come up, newer biometric techniques that have come up, or newer formulas. There has to be a lot of counseling that has to be done with the patient regarding what the target refraction is going to be. And it is a teamwork. It is just not the surgeon who is entirely responsible for the eventual outcome. So whenever, most of the time when I have a very good result, a biometric post-operative result, so I make it a point to congratulate the biometrist. I find out who has done the biometry, because if he or she hadn't done a good job, in spite of a very well done surgery, complex surgery, complicated surgery, the patient is not going to be happy, because patient is finally going to evaluate you with the visual outcome, not with which machine, phaco machine has been used, whether any other laser was used for the surgery, or what microscope, or so on and so forth. So biometry is very, very important. It's a huge topic. There are a lot of issues that come up. It is a topic that is very close to my heart. And since we have a limited time, so we will just discuss a few relevant aspects in this particular meeting today. Sandhya will talk to us on optical versus immersion biometry. Immersion biometry still has a very important role to play in our scenario, Indian scenario. Dr. Anagha is again an expert in this particular field. She's going to talk to us on angle alpha and kappa, the relevance in cataract surgery. There's a lot of talk going on. This becomes quite relevant when you talk about the advanced technology intraocular lenses. We have Dr. Ellen from Bangalore, who will tell us about how he calculates for aphakic patients and when he considers secondary intraocular lenses. Arvind is on his way. Arvind Moria will tell us about IL calculation in eyes with posterior segment pathology with silicon oil field. And we'll have none other than the showstopper, Mohan Rajan, talking about the ideal intraocular lens formula. So before I ask Sandhya to come on stage, Sandhya, please be on stage. And I just would like, we may not have much time for discussion perhaps, so I'd like to just inform the House that, the way to go about the whole business of proper biometry is, adapt to the new technologies as they present, validate your measurements, employ the recent formula, the right formula for the given patient, work with properly optimized lens constants, and you use all the available resources and put them to the best use